Prostate removal to treat prostate cancer is associated with excellent results. However, there are important things to consider when choosing the right treatment. The radical prostatectomy involves removal of the whole prostate. Removing only the areas of the prostate that had the cancer or the suspicious areas on the MRI would not provide cure rates as high or as long as removal of the whole prostate. Keep in mind, the prostate is mostly used for fertilization and is not needed for other functions. The surgery can be done robotically or with an open incision. The robotic approach uses a robotic instrument and involves 6 small incisions around the belly button. The open incision is about 10 to 12 centimeters from below the belly button to above the pubic bone. Studies have shown that there is no difference in the results or outcomes of getting the open versus robotic prostatectomy, except that the blood loss and recovery are better for the robotic procedure versus the open incision. For the robotic surgery, there is typically a one-night stay in the hospital. A catheter would be needed for 1 week and then removed. For the open surgery, there is a 2 to 3 night stay in the hospital, and a catheter would be needed for 2 to 3 weeks. The catheter would stay in until the stitches heal from where the doctor attaches the bladder to the urethra. It's important to note that when catheters are removed, urine leakage is normal. It will take several months to strengthen the sphincter muscle through Kegel exercises and recover function. The most common complaint after surgery is feeling bloated and gassy, which can linger for 2 to 3 days. Another complaint is the sensation of needing to make a bowel movement or go to the bathroom, which is usually due to the Foley catheter and typically goes away in 1 to 2 days. Most patients do not have severe pain after the surgery, and almost 80% of patients do not need opioids or narcotics after the surgery to manage pain. After surgery, we recommend that patients move around and walk to prevent complications like blood clots and pneumonia, and to help recover function of their intestines. Using the stairs is acceptable, but it is not recommended to lift anything over 30 pounds. Most patients report that it takes about 2 to 3 weeks before they feel back to normal, but fatigue may linger for 4 to 6 weeks. It is recommended that a patient take off from work at least 4 to 6 weeks to recover. Some patients choose to return to work earlier than 4 to 6 weeks or choose to work remotely. Recovery is very personal and will differ from person to person. Results cannot be guaranteed. We hope our resources help equip you to make the best decision possible concerning a prostatectomy. Have a question? Come prepared to discuss your questions at your very next office visit, or call us at 215-622-2891.